Hello, everyone. Good evening. It's Dr. Tamara Beckford with Your Caring Dogs. And again, we are here live on our Facebook page and on our regular page so that we can. Oh, it says you can't tag people right now. Oh, Facebook's having some issues. Say, I agree. Okay, that's fine. We are here on our page because we're doing our weekly medical discussions, right? So today we will be discussing ear infections. As usual, if you like the information that we're presenting today, like, share, subscribe, and definitely leave a comment, right? We love to see the comments. That helps us, keeps us motivated too. So let's get started. As usual, this is for information purposes only. We know that Your Caring Dogs is a telemedicine urgent care that allows people to see the doctor quickly for their non-emergent medical issues that occur at inconvenient time through telemedicine, like what we're doing right now, video conferencing. All right, so we are going to get started and talk about ear infections. Oh, mighty ear infections, they hurt, don't they? Yes. So, and it affects kids and adults. So we're going to go over the two biggest types of ear infections, which are the otitis externa and the otitis media. I'll go over what all of that means. As usual, we are going to start off with our anatomy. Yes, and my anatomy drawing, as per usual, right? So I do have these things in color coordinated so that we can understand what's going on. We're going to first start off with otitis media, which is a middle ear infection. So media, the middle, otitis, inflammation of the ear, right? So we're going to go over a little bit of anatomy. As usual, sometimes my face will get covered in this period of our lesson. So we have the ear lobe, to the outer ear, and we have our ear canal. After the ear canal, we have the eardrum. Another version or name for it, the medical term is a tympanic membrane. So that's our eardrum. Behind the eardrum is where our middle ear lies. And because this is a middle ear infection, this is where a lot of this infection occurs. Beyond the middle ear is where we have our eustachian tube. So our eustachian tube runs from the middle ear to the back of the throat, right? That's from here to the back of the throat. Now you all remember your eustachian tube because when you're flying on the plane and at times you're just like chewing the gum and swallowing, you're doing that in order to equilibrate the pressure behind the eustachian tube and the ear canal, so the outer and this portion, in order for your membrane to get stabilized and to reduce the pain. Now, when you have a middle ear infection, the middle ear infection occurs for a few reasons. There are a couple, you can have viruses, bacteria, or allergies that are the inciting reason behind the middle ear infection. Now, we've talked about our eustachian tube. The eustachian tube allows the natural fluid that our air secretes in the middle portion to drain out. So it'll drain out to the back of our throat. Usually, you're not really noticing it because you're just swallowing and moving along your day. However, if the eustachian tube, if this canal area, this eustachian tube portion, sorry, if your eustachian tube portion, hope you guys can see it, that area, if it becomes inflamed or swollen for any reason, such as if you're having like allergies and you're just congested, then the fluid that would naturally drain out is unable to do so, and therefore the fluid builds up inside the middle ear. As usual, anytime a fluid builds up in an area and it's stagnant, it's not moving, and bacteria is there, then the bacteria can multiply. When that bacteria multiplies, that's what causes the middle ear infection. Now, on the other end, what the physician does in order to determine if this is a middle ear infection is that they use a device called the otoscope to look in through the canal, and they shine a light onto here, your eardrum, which is also the tympanic membrane. So naturally, your eardrum, when we shine a light on it, the light just reflects back to us, right? So the light reflects there back, just like if you have a regular drum and you shine a light on a thin membrane, it just reflects back on it. So this looks nice and healthy. However, if it's infected, then the eardrum is red and it's dull, right? And sometimes with the otoscope, when you're shining the light on that area, you can also see the fluid that lies behind the eardrum. And that gives you, along with the fact that the patient's having fever, pain, then it says, yes, you have a middle ear infection, right? So, how is the middle ear infection treated? You have a lot of kids that get the middle ear infection because of the fact that naturally their eustachian tube, because they're still being developed and they're still young, so their tube is narrow at baseline. So you and I, our tubes can get narrow because we get congested. Their tubes are narrow because that's just how it is. They're young. It hasn't fully developed to its adult area. So kids get a lot of infections, especially when they're in the very, very early pediatric ages. Now, if you're less than 6 months of age, then the doctor is usually gonna give antibiotics. However, as you know, we're trying to reduce the amount of antibiotics that we're continuously given to our patient population, and so the doctor might do a wait and see period. You call your doctor, let them know what symptoms you're having. You let them know what symptoms your child is having. You see them, you follow up, and then they'll determine if you or your child is a candidate for antibiotic therapy or if you are a candidate for waiting and seeing and treating symptomatically. The reason for that is the initial portion of most otitis media, which is the middle ear infection, is usually due to viruses. And as we said with viruses, viruses can you treat the symptoms. However, if you do start having a bacterial infection, then it's treated with antibiotics. Hi, Kisha. So, with the otitis media, like we said, you will have pain, and we're treating symptoms initially. So you're doing ibuprofen or Tylenol. And as I said, talk with your doctor to see if your child, which category they fit in, and which medication is best for them, right? So you're treating the symptoms, you're getting rest, drinking lots of fluid, and you're just trying to stay out of pain and reduce your fever that usually occurs with that. Now, our second type of infection is the otitis externa. So now we're just drawing the ear just from the opposite end, right? So this is our earlobe, and this is our ear canal. As you can see by my drawing and coloring, this ear canal at this portion is inflamed and it's narrow, and you're having redness and drainage from that. So that's the difference between the otitis media and the otitis externa, is that you notice I haven't shown anything about the eardrum because it's on the outer portion, it's on the canal. So I'll use my initial drawing just to give you an idea of where we're talking about. So the otitis externa is on the canal out here, right? So we all have earwax. Yes, yes, we do. There's a reason why earwax is there. So naturally, our ears, it's skin, so it secretes, right? So the earwax helps to, one, get rid of debris that's normally formed within the canal, and two, it also keeps the environment acidic in order to make it inhospitable to bacteria, right? So when one of the common reasons for having the otitis externa is if you have swimmer's ear, if you are swimming in an area where there's a lot of bacteria, and say, hi Janelle, great to see you again. Thanks for stopping by. But say you're in an area where you have a lot of bacteria and you're swimming and the water is still within the ear, it's not cleaned out, it's not dried out, then you harbor the bacteria there, and that increases the chance of you getting the otitis externa, which is the swimmer's ear. Another thing that can cause that too is aggressive cleaning of the ear with instruments. When we say instruments, we're talking about a cotton swab and you're like digging it and swirling and, trying to get rid of that wax. Or if you start to use instruments such as hairpins, some people use the back of the hairpin because they just go in and they want to get that wax out. When you do so, you start to scrape and cause scratches and abrasion to the canal itself. Now, after you get the abrasions to the canal, then you are able to introduce bacteria into the area. Once a bacteria gets in, it multiplies, the canal starts to swell from inflammation and pain start to ensue, the redness starts spreading, and then you start having drainage of bacteria. So it's usually very, very, very painful. And some of the signs and symptoms of that is that you'll start having some itching in the ear, and then the itching might get worse, and then you start to notice that your canal is getting swollen. You start having redness around the area. Your earlobe might start to swell a little bit, and then you might start having drainage and decreased hearing. Right? Everything just sounds muffled. Like, what is she trying to say to me? In addition to, of course, pain. Pain, pain, pain. So if you're having otitis externa, a lot of times we still would try to use the otoscope, but a good time if the externa is really, really bad and it's swollen to the point that you can barely get the otoscope in there in order to look in, then I mean that's letting us know you're having an otitis externa infection. How do we usually treat it? Well, as we mentioned, the body naturally with the wax keep the area acidic, and therefore sometimes you'll use, if it's not a severe infection, they'll try to use an acidic solution in order to make the environment inhospitable for bacteria and to get rid of it. If the infection is very severe, where the canal is almost swollen, you're having pus and drainage, then of course you're going to be using antibiotics. Now it's important for certain type of antibiotics to ensure that the tympanic membrane, which is our eardrum, is not ruptured, because most of these antibiotics are liquid solutions which are put in the ear, right? Now, if the ear is so swollen that you can barely get the liquid solution in, then an ear wick is used to help to apply. So an ear wick is a gauze or cotton swab that's placed within the ear, and then you drop the solution on it. So it keeps the solution within the ear in order for the antibiotics to spread in the local area. So your ear wick will essentially be wedged in here, and then the antibiotic can spread to these areas and get rid of the infection, right? Now, another thing that can cause infection is if you're wearing jewelry that you might be allergic to it. Like, say, if you have an earring and you're allergic to that particular type of metal, or you're spraying your hair and use, hairsprays, hair dyes, and they go into the ear, and you've already caused issues with scraping the air because you're cleaning out your wax, and of course you also introduce the possibility of having infections. So those are the common ways that this happen. The treatments, like we said, antibiotics drops, acidic drops, and then also you will need to treat the pain. Oh my goodness. Yes, yes, yes. This is going to be painful. So start with over-the-counter medication, Tylenol, ibuprofen, or Aleve. It's usually used to help treat the pain. Now, if the pain is unbearable with any of the above, then of course you're going to move on and talk to your doctor and let them know, and then they can write your prescription for something that's stronger to help to alleviate the discomfort. Some of the things that, of course, that you're worrying about is you're having persistent fever, and then you're having swelling. That's even though you're on these ear drops, it's still not improving. Yes, you will need to go back to your doctor because they might need to add oral medicine, right? So it's an infection that's localized, but if it starts to spread beyond the local area, then you're going to have oral medicine, and not just the ones that's external to put in the ear. So it's not just going to be the ear drops. Yeah, it can be pretty bad. Now, for a bonus, I usually like to give you guys a bonus info. Now, if you press on, you lift up your earlobe, and then behind it, you'll find a little knob there. That bone is called a mastoid bone. If you're having any of these ear infections and you're taking your antibiotics and you press on the mastoid bone and you're not having, and you're noticing that it's very, very, very painful, like you're pressing on it and you're having super bad ear infection, you're taking your medication, you're taking your antibiotics, you're not improving, you're having fever, and you're pressing on that, then you can have what's called mastoiditis. So with mastoiditis, that means infection is now gone into and is inflaming the mastoid bone. This is something that you would need to go to the emergency room for. See your doctor and let them go ahead and get treated. Okay? So that is our presentation on ear infections. I hope you enjoyed it. As I said, if you did, then like, share, subscribe, definitely leave a comment. I'm Dr. Beckford with Your Caring Docs, our telemedicine urgent care that aims to treat people quickly for their non-emergent medical issue that arrives at inconvenient time. I look forward to seeing you guys next week when we have another great topic. All right? Let me know what you guys think. See you then. Bye bye.